Hi everyone, this is Alex Caney with LiveWell, Colorado, and I will be your moderator for today's webinar. I have a few housekeeping items to cover before we get started. The first is that we will be recording this webinar, and it will be available on our website tomorrow morning on the livewellcolorado.org site. Select Toolbox and click on Webinars in the Toolbox menu. Second, we will have some time for Q&A at the end of this webinar, and if possible, please let us know who your question is directed towards. You can type that into the chat box, and we will revisit those at the end of the webinar. All you'll need to do is all you'll need to do is enter your question in the chat box, and we'll revisit it towards the end. Now I'd like to introduce our first presenter, Lisa Walvoord of LiveWell, Colorado.
Thank you very much, Alex. I'm not a presenter. I think I'm just here to convene everybody, and the real experts here. I am super excited for today's webinar, not only because we had about 130 people from all over Colorado, as well as Indiana, Kansas, Montana, South Dakota, and Wyoming register for this webinar, but because this topic is truly so important to ensuring that all Coloradans, and clearly those in other states, have access to healthy and nutritious food every day. What was once emergency food assistance has now become the norm in the lives of too many Americans and too many Coloradans. We call it community or nonprofit food assistance, and while our greatest goal and hope is to rid ourselves of the need for this assistance, it is very much our reality today. So it's crucial that food banks, pantries, churches, and congregate meals are positioned to play the role that they do in food access in all communities across Colorado for people of all ages and all ethnicities. There's a growing interest and accelerating momentum to ensure that the food provided through these venues is as healthy and nutritious as possible. It's not enough just to provide calories. We need to provide nutrition to ensure the most basic health and well-being of our fellow Coloradans. So we're really fortunate to have some amazing efforts happening here in Colorado that we're going to share with you today. I'm giving you your welcome, and then we'll hear from Tom Reed of Community Food Share to talk about a policy perspective and share his organization's new nutrition policy. Then we'll hear from Melissa Marts and Karen McManus about how their policy efforts have brought about new programs and partnerships. And finally, we'll hear from a true social justice leader, Dana Miller, about how we can all develop partnerships in our communities. So you can see all the beautiful faces here. And as Alex mentioned, please do submit questions throughout the webinar and indicate who you would like to respond to them. And then at the end of the webinar, we hope to have time to get through all of the questions. So with that, I'm going to hand it over to Tom.
Good afternoon, everyone. My name is Tom Reed. I'm the Food Procurement Manager at Community Food Share. We are the food bank for Boulder and Broomfield County here in Colorado. And about a year ago, we implemented a new nutrition policy statement. The purpose being to try and improve the quality of the nutrition coming through our food bank. Now, this first slide, one of the things we did with our statement was we assigned an owner. That's our Director of Operations. For a couple reasons, somebody needs to take ownership of that policy to keep it updated, and somebody needs to take ownership of that policy to report back how we're doing against that policy. So that's our Director of Operations. And again, the purpose of the policy is to document our commitment to providing more healthy food. So Community Food Share has been in business over 30 years, and for the majority of those years, we've had a statement that kind of sets our direction that says that food insecure individuals will have access to nutritious food. And nutritious is a little bit ambiguous, so behind that we had a statement that said we will provide food in accordance with the food guide pyramid. And so we always reported against that we were distributing food more or less in accordance with the way the food guide pyramid was laid out. Well, the food guide pyramid went away a couple of years ago, and the new food plate is more difficult to report against. So we decided we were just going to generate this new policy that would determine how we report on the nutrition of the food going through the food bank. So basically what our policy says is, whenever feasible, we will purchase only low-sodium canned vegetables, low-fat protein items, and whole grain products, and that we will also try to bring in more fresh fruits, and vegetables, which are obviously very nutritious, and minimize our financial resources to bring in things that we deem not as nutritious. So basically, our food bank, approximately 90% of the food that comes through our food bank is donated. So really, this policy has almost no effect on that food. If somebody comes to our food bank and says they want to donate food, we're not going to turn it away. However, I'm also not going to go out in the community and specifically solicit donations for items we consider not nutritious, candy, soda, stuff like that. So while we won't turn down a donation, I won't go actively seek them. The other 10% of the food that comes through our food bank is actually purchased. This policy has a tremendous effect on the items I go out and purchase, because I cannot purchase outside of the limits of this policy unless there is just no other option. For example, if I needed to go buy canned vegetables and I just can't find any that are low sodium, I can buy something else so that we have some food available, but that's a pretty extreme chance that would happen. So it has a very direct effect on the food that I go out and purchase. Another key part of the policy is we say that we will bring in this food whenever feasible, and some other terms. We have to define those terms. So feasible, whenever feasible means basically that it's available at a reasonable cost. So if the product I'm looking for is available at a reasonable cost, that's what we will go after. And then I also define low sodium as defined by FDA, which basically there are labeling requirements for companies. If they claim their product is low sodium, they have to meet FDA guidelines to call it that. That's the guideline I'm following. Essentially the same for low-fat protein foods. I am actively searching out low-fat items. And made from whole grain means like pasta made from whole wheat, or any other grain product. Like for our rice that we purchase brown rice rather than white rice. And then we define basically unhealthy foods is essentially anything with high fat, high saturated fat, high cholesterol, high added sugar, high sodium, high calorie content like soda, candy, energy drinks, and whatnot. Our policy says we will not expend financial resources to go after product like that. One example might be a donor in Denver might have a truckload of soda. If they bring it to us, I would accept it. If they say you have to send a truck down to pick it up, I will not, because then we have to spend resources to do that. So again, the policy doesn't have a whole lot of effect over donations. It has a tremendous effect over the items that we purchase. Again, our Director of Operations is responsible for the policy, and we review it annually just to make sure it's still working and make sure it makes sense. The final slide is a report that we get out of our inventory system. When a food comes in, we use a system called CHOP, choosing healthy options, to rate the food that comes in. And that rating goes into our inventory system, and then this report comes out. So the pie chart on the left, for example, says of all of our inventory, almost 70% of it rates green. So our rating system, green is very healthy, fresh fruits and vegetables, eat as much as you want. Yellow, eat in moderation. Red, avoid if you can. And there's a fairly large pool of items that we just can't rate. Any items that come in a mixed pool that you just can't get a rating on. So before we implemented our policy, we used a 6-month time period where we sent a baseline and said, here's the baseline of the product coming in through the door. We're going to improve on those numbers. So basically we want to improve on the 70% green and have that number go up. We also want to improve on that shows that approximately 27% of our inventory is not rated, so we don't even know the nutrition of that stuff. We want to decrease that number and increase the green rating. Now on the right side, that pie chart is of everything that is rated. That tells you what is rated green, yellow, or red, and about 80% of everything that gets a rating is rated green. So we look at that and say the product going through our warehouse is largely highly nutritious, and that's our goal. Our future goal is to improve on that, but right now that's where we are, and we believe the food going through our warehouse is generally very nutritious. Thank you.
Great. Thank you very much, Tom. And we've received a couple of questions that we'll get to at the end, and if others have questions for Tom, if you would please submit those, that would be great. And next up, we have Melissa Marts from Care and Share Food Bank for Southern Colorado.
Thanks, Alex and Lisa. So yes, I was actually previously with Care and Share Food Bank for the past 5 years. I just recently had an opportunity to move on and become an executive director at another organization. So Care and Share was left in good hands with folks that are running the show after I've walked off. So, and there'll be names of those folks at the end. So I just wanted to share a little bit about kind of what we do, Care and Share Food Bank for Southern Colorado. Basically, we serve 31 counties in Southern Colorado. So for anyone that's on the line in the southern portion of the state, I would do a shout out to you all. Basically, that means we have to cover 55,000 square miles of people who are hungry, and it equates to about 160,000 people and 54,000 children. And so lots of need out there, which means that we can't do it alone. So Alex, next slide. Thanks. And basically, when I kind of started at Care and Share, we were serving about 11 of our 31 counties. And at this point in time, now Care and Share has been able to get food out into all those counties. As we were able to meet that goal, the next thing that we wanted to start to look at was realizing that we want to be part of the nutrition solution. We wanted to be contributing to people's health and wellness and not just necessarily contributing to, just empty calories that made people feel like, at least they had something to eat. We really realized that with the obesity epidemic going on, and especially in cultures and communities where there was high poverty, we really wanted to branch out and do more than just basic hunger relief. But back 5 years ago, that was what we did. So we were really a very typical food bank back then. We worked with the USDA programs. We were really looked at as kind of a supplemental food source, which meant that sometimes that supplemental food was nothing more than bread and high-calorie soda drinks, not so much nutrition. And, of course, we were thrilled when we got produce, but the produce wasn't always in that best of shape, and folks weren't always sure what to do with it, and then it would end up kind of more in the garbage than in people's kitchens and in their bellies. So that was kind of who we were 5 or so years ago. And over those 5 years, we really reached out to create partnerships. And I think one of my messages today, which I think will be similar to Karen's as well, is just how important it is that we all, kind of reach out to the people that we know and the people that we don't know and figure out how to solve the problem together. Especially for Care and Share working in 31 counties, we really relied on connections in places other than our hometown of Colorado Springs and Pueblo. And one of the first things that really got us going was we kind of had our feelers out, and we applied for and received an impact grant from the Colorado Garden and Home Show, which their name should be up there. I did not type that in there, so I was remiss, but basically we owe so much to that organization in Denver. They do a super job funding local food efforts and really wanting to do good things around growing food. So we got a great impact grant, which allowed us to branch out into the communities around southern Colorado and work to create, gardens and other ways to process food, and just bring that out to the communities that we served and partner with folks out there. And then it also allowed us to add to our gardens. Care and Share actually has gardens on the property in Colorado Springs, and we were able to build a passive solar greenhouse, which allows us to grow food year-round and also do starter plants, in the spring and get those into the gardens. Another, partnership that came up was in Colorado Springs specifically, Pikes Peak Urban Gardens. Pretty much so many communities around the state actually have some type of garden organization that's working to, put gardens in communities. And so we partnered up and encouraged Pikes Peak Urban Gardens to actually do gardens in low-income communities, and not just, they actually were a fee-for-service initially, and now they have branched out and they actually do other gardens and help to raise money to make them happen in communities where there's need. Also, lots of partnering with local school districts, and in the beginning, specifically in El Paso County, actually, nope, it's actually for our whole entire service area, which again shows how far we have to go. The slide before talked about, I think 54,000 children in southern Colorado that are hungry. We were feeding about 1,000 kiddos throughout southern Colorado through the food bank network that we have. We're now doing about 8,000 kiddos in partnership with local schools, which is such a drop in the bucket, but still an effort, and it relies on partnerships. With the support of food pantries in the area, we're actually doing about 24,000 kiddos, but still that's 50% of the need. The other pieces we wanted to throw in had to do with nutrition and helping folks stretch their resources and dollars. And so the food bank, again, partnered up with Share Our Strength here in Colorado and set up Cooking Matters programs. And then we also set up food assistance programs. We actually do the food assistance program throughout southern Colorado, the Cooking Matters programs. We have 2 programs in Colorado Springs and Pueblo, but of course Share Our Strength has got Cooking Matters programs in many of the regions in southern Colorado, which is great. All of these are things that people that are in their own communities can just reach out and start to build partnerships and expand services that are there and just get to know people better and continue to give each other the support to keep this movement going. We too adopted a nutrition policy at our food bank, similar to what Tom talked about, and that really helps to keep us accountable to the general public. It gives us an opportunity to say, yes, we really are focusing on bringing in nutritious food, and this is how it looks. And just recently, as I was getting ready to transition out of Care and Share, we've really increased this whole idea of supporting seniors and getting them nutritious food as well. Meals on Wheels programs have been out for a long time, and they've tried to do really nutritious, meals. But there's another need for seniors that might not have access to Meals on Wheels programs or might not be able to, participate in paying for part of that, and just looking at, what partnerships can be created to help make sure that seniors get the food they need, and also getting out to, garden or participate in farm programs and, be part of the community as well. Just because they're seniors doesn't mean they can't be a part of it. So that's kind of the scope of the things we've been working on at Care and Share for the last 5 years and are going to continue going forward. And Jennifer Mariano, who was my director of programs while I was there, she's familiar with many of these programs and is going to continue the efforts to keep them rolling. And just one last example, she's been working down in Montezuma County in southwestern Colorado in the little town of Cortez, and trying to find partnerships with local restaurants down there who use local food to help actually prepare the snacks and meals for the kids in the summer feeding programs down there. So again, it's just all about partnerships and getting the word out and finding who has similar interests and making it happen. So it doesn't just have to be the food bank doing it, it's really all of us. And I guess that's my final point. And thanks so much for letting me be a part of this today.
Great. Thank you very much, Melissa. And I mean, I can't stress enough the point you just made of the nature of partnerships and being essential to all of this work. I mean, I look around this room, and I'm just meeting Tom for the first time, but everybody else I've had a chance to partner with and work with, and that is just essential to moving this work forward, to learning from each other, and kind of building on the different ideas, but within your own community, finding those relationships and building on it. No one should be trying to go at this alone. So that, Karen, is the queen. If you want to take it from here, Beth.
My name is Karen McManus, and I am the Food Resource Manager at the Food Bank for Larimer County. We have 2 food pantry sites in Fort Collins and in Loveland. So to build on what has been said so far, I think we all agree that as service providers to at-risk families in our communities, we must care about health and nutrition. Hunger is a public health issue, and children who are hungry cannot learn well. Parents who are hungry cannot parent well. Hunger has a direct impact on our society as a whole. As a food bank, our priority is to impact public health in a positive and substantial way. Our overall goals will take several years to achieve. However, some of the things we've done so far include evaluating our systems in our warehouse, creating new categories for the food we bring in, and creating a rating system for all the categories of food. Examples include dairy, meat, and bread. We continue to create new, more specific categories so we can track these items by their nutritional content. So where we once had one generic code for all bread and baked goods, we now have 2 codes, one for bread and one for sweets. And this allows us to track these items through our inventory system and the distribution process. The creation of a rating system by our registered dietitian allows us to look at the nutritional content of the food that we're distributing. This rating system is based on dietary guidelines and current nutrition science. Examples of the nutrition criteria used are calorie limits, fat and sugar content, as well as sodium, fiber, and protein. Having such a system in place, we are in a better position to secure the food that meets our guidelines when purchasing products. Likewise, donated products can also be rated by its nutritional content, allowing us to evaluate all the food coming into our warehouse. Along with what we've done so far, we have some important next steps to take in order to reach our goals. We are working toward having the systems in place to track every food item coming in and going out of our warehouse by its nutritional content, and defining how to implement this with our clients and agencies. Making the best use of our series software program, we are currently able to track our inventory from acquisition through distribution, and we'd like to implement this rating system into the tracking process. And another important next step is communicating this good work to our donors. Distribution of the most nutritious foods possible to our clients equates to fresh fruits and vegetables, along with protein-rich and nutrient-dense foods. We have continued to increase the amount of produce into our inventory with the goal of having produce make up between 40 and 50% of the overall mix of foods we distribute annually. One thing that we have done to achieve this is creating the position of the Food Resource Manager. This has allowed our food bank to have one staff person dedicated to sourcing fresh local food through a variety of avenues. So, some of the ways we source food are listed on this slide that you're looking at now. The choice system refers to the online purchasing system through Feeding America, our parent organization, and provides us with access to truckloads of products available anywhere in the country. Our grocery rescue program involves drivers picking up donated products from area retail stores, many of which have corporate guidelines with Feeding America already in place. Our refrigerated trucks can transport this product safely back to our warehouse until it can be stored in our cooler and freezer and distributed to our clients. Working with farmers in our area, we educate them on the benefits of donating to the food bank, which include lower waste costs, positive marketing opportunities, and a direct impact on hunger relief in their communities. Along with securing fresh produce while in season, we also take advantage of gleaning opportunities at the end of the season. This involves groups of volunteers going into fields to harvest as much consumable product before the field is turned under. Working with other food resource managers like Tom Reed here, from across the state, we are sourcing to excess so that product can be shared among food banks that aren't necessarily located in a donor's geographic region. And as food resource manager, I have found that one thing that has resulted in an increase in our food donations has been staying engaged with the community by attending meetings, workshops, and events. This provides me with the opportunity to get the word out about our needs and to educate the public about opportunities to donate. Collaborating with existing community partners, we are able to secure donations from school districts and other institutions, farmers markets, and the ever-increasing grassroots movement by citizens concerned about hunger in the community in which they live. One such project in the Fort Collins area is called Plant It Forward, and it's a collaboration between the food bank and a city-managed community and demonstration garden. Plant It Forward provides backyard and community gardeners a place to drop off excess produce on the weekend when the food bank is not open to accept donations. Produce is weighed and a receipt is provided to donors for their records. The produce is stored safely until Monday morning when we are able to pick it up and bring it into our inventory. In its third year now, the program is gaining strength and the donations are steadily increasing. We emphasize that no donation is too small, and to make sure that the gardeners donating their produce are thanked and made aware of how important their contribution really is to the food bank. While this seems like such a small gesture, it really has resulted in gardeners wanting to donate more. We have heard time and time again of plans to increase garden size to accommodate for more produce to be donated. So it's not enough to bring in all this good food without the education piece involving what to do with it. Our registered dietitian and the interns that we have on board conduct cooking demonstrations and tastings regularly in both of our food pantry locations while our clients are shopping. They choose items that are plentiful that particular day so that clients can not only see what to do with them and taste the results, but also pick up the product as well as the recipe. They then have what's needed to duplicate this process at home.
Hi, that was awesome. I'm so inspired. This is Dana Miller, and I am the co-director of the Grow Local Colorado campaign. And we promote local food, local economy, and local community. We do that in a number of different ways, including growing vegetables in selected city parks in Denver and the food communities in need. So Grow Local, last year we got pretty committed that what we really wanted to be involved with in the future was for more gardeners to be involved in donating to pantries and to communities in need. So we reached out last year and ended up kind of connecting with Cooking Matters, with Megan Bradley over Cooking Matters, and that was kind of, it took about a couple of emails, and all of a sudden we had about 10 or 15 organizations at the table that wanted to come together to work on this. So let's look at the mission of Produce for Pantries. Yeah, thank you. It encourages, we are encouraging, we're encouraging home, school, and community gardeners to plant, grow, and share food with food pantries and others in their neighborhoods. So how we're doing this, we think it's in a really beautiful and elegant way, is that food pantries are being connected with the home gardeners in their neighborhoods, with school gardens in their neighborhoods, and with the community gardens in their neighborhoods. So it's really hyper-local, very freshly grown, very little carbon footprint on this food going directly from gardens into food pantries. So that's basically our mission. Our vision is we envision a vibrant Colorado with communities working together to address hunger by growing and sharing of food. So this, we spoke earlier about the value of partnerships, and we are very proud with our partners, the list of our partners. So let's look at those a little bit. On the right, you can see a beautiful picture of some of our partners at a recent meeting. So Grow Local Colorado is involved, Share Our Strength, Cooking Matters, Denver Urban Gardens, Slow Food Denver, LiveWell Colorado, Hunger Free Colorado, Keep going. Yeah, no kid left hungry. Plant a row for the hungry. Yard Harvest, Denver Food Rescue, Brighton Shares the Harvest, St. John's Episcopal, Metro Caring, and Food Bank of the Rockies. An impressive bunch, and we're very honored to be working alongside these folks. So how that kind of works, in order to connect food pantries with the school gardens, we're going through Denver, with Slow Food Denver at this point, because Slow Food Denver is involved with a good amount of the school gardens in the Denver area. So they're connecting with the school gardens to encourage the school gardens to grow for their local food pantries. And then the community garden piece is being handled by Denver Urban Gardens. And they're connecting with their community gardens to create more donation programs in community gardens. And those are both the school gardens and the community gardens, huge opportunity to get people involved growing for their local food pantries. So and another really, really wonderful thing that just happened in the last week is we're now partnering with the Hunger-Free Hotline. So statewide, if there are people all over the state right now that want to grow and they want to find information about their local food pantry as to where they can donate, they can call the Hunger-Free Hotline at 855-855-4626, and people will be able to get information multilingually from 8 to 4:30 during the day to get information about their local food pantry, which is awesome. So we can go statewide pretty quickly here. Another thing that we're developing along with LiveWell is a guidebook that we're calling Produce for Pantries, Local Food for Local Need, and it'll be a guide to food donations for Colorado gardeners. And that will be, we're working on that right now, and that will be sent across the state relatively soon so that people can start a Produce for Pantries type program in their community really easily. They'll have access to Produce for Pantries graphics materials that we've already developed, and all sorts of ways to start to get gardeners in cities all over Colorado to start growing for their local food pantry. I wanted to talk a little bit about another really exciting partnership that we have just recently created, and that's with the Garden Centers of Colorado, which is kind of the mothership for all independently owned garden centers. And we are partnering with Maxfield Organics and the Garden Centers of Colorado to get information to those garden centers. Hopefully in the next couple of months, they'll all have access to bookmarks and to posters encouraging people that go in when they're buying their seeds and seedlings, when everybody's really excited about doing that, to encourage those folks to grow for their local food pantry. They'll have information right there about how they can call the Hunger-Free Hotline to get information about how to do that. So let's see. We're going to go real quickly through the next couple of slides. We do have food safety guidelines in terms of how people, if they want to grow food, what we suggest that they do. So please donate high-quality produce to folks. This is an opportunity for us to honor our neighbors by bringing lovely produce into food pantries. So we have access to these guidelines. We can zip through them really quick. So washing your hands, using the proper containers, cleaning the containers and scissors properly, some sanitization, just kind of how to handle the produce and how it can be stored and how it's really great for it to be cut and taken to a food pantry relatively quickly. So we'll have access to our food safety guidelines. So rest assured that those are being worked on and disseminated. So one of the things I'd like to do is to ask for your help out there. Although you wonderful people who are listening, if we could have your help, we'd really, really appreciate it. In getting out the word, your newsletters to your organizations, if you want us to come speak, if you would like, if you're involved in the media or television, we want to really get out this word of growing for our neighbors. So any way that you can help us, please email us at produceforpantries@gmail.com. That's produce, F-O-R, pantries @gmail.com, and let us know how you can help us get out this word. And also, we don't need a whole lot of funding, but a little bit of funding would be helpful in terms of printing some information and getting out kind of some media campaign kinds of things, we'd really appreciate that too. So once again, Produce for Pantries, very excited about being able to help the whole food distribution system in Colorado so that we can get some of this beautifully grown local produce into the hands of those who need it. Thank you so much for allowing us to be here today.
Well, thank you, Dana, and thank you, Karen. We do have a number of questions, and you guys did an amazing job of getting through some really rich content in a timely manner, so we have time to answer your questions. So we'll start moving through the questions we have, but please do continue to submit them, and we will hopefully get through all of them. I know there are a couple that are more comments than questions, and so it might take us a little bit to figure out how to respond to some of them, but we've got a few quickies.
Our first question is for Tom here. The question is, does your purchase policy include buying organic food from local suppliers?
Marcia, great question. Currently, it does not. We buy right now in such large quantities that there really aren't any local suppliers that can meet the needs we have. That said, I'm always keeping my eyes open for local opportunities. But at this point, the policy does not address that, just because in our region there just aren't any manufacturers that manufacture in large enough volumes for us.
Thank you, Tom. We have another question for you as well. Why does your organization not hold donors to the nutrition policy statement? This is a comment that says they find donors are happy to provide more nutritious foods when asked for more nutritious foods.
Brooke, that's a great question. I have yet to meet a donor who doesn't get what we're doing. They're really on board with us trying to up our nutrition. But that said, there are several reasons why our donations really aren't held to our nutrition policy, and one of them is we just don't have any significant donors in our geography that donate that kind of food. I don't have a soda bottling plant. I don't have a candy manufacturer, so there aren't any real big manufacturers that would donate that kind of stuff to us. So I really don't have the opportunity to say no. And secondly, a lot of times a donation is more than just the donation that's coming in the door that day. That may be coming from a company that also may be a financial donor, or they may have other products that are attractive to us. So it's just very hard to say no to all of those donations and to expect our nutrition policy to extend out to donors. Now, that said, as an example, the LA Regional Food Bank was one of the first ones to take on a food rating system. And I know they have some large soda bottlers in their area, and they do say no. They don't take their donations any longer. If we are in that situation, we might do that also. We're just not in that situation right now. So basically, if they come to our door and have it, we say yes.
Thank you, Tom. Our next question, how do we get our food bank of the Rockies to look into these great programs?
This is Karen. Actually, we are working with Food Bank of the Rockies. The 5 Feeding America food banks across the state of Colorado are working together quite closely, and we do work with Food Bank of the Rockies. I think that to Tom's point he just made, that we really need to understand that a lot of the food that comes to the food banks is donated food. And that means we really don't have a choice in what is being donated. We don't want to turn away food at the door. However, with the purchase products, we are all looking at doing a much better job of securing nutritious food. So I think that Food Bank of the Rockies is doing an amazing job, and I think that they're on board with this.
Thank you, Karen. We have another question about community and school gardens. This person says, I love to hear about community and school gardens. Are there any efforts to make this food production year-round with greenhouses?
This is Dana. Some are. I don't know a lot of the details about community and school gardens. I would certainly suggest connecting with Denver Urban Gardens or Slow Food Denver to find out any particular efforts around food production year-round. But Katie, is it Katie? Kelly. Kelly, it's a great question, and it's a wonderful opportunity for growth in the future.
And this is Karen, and I do think that we are seeing much more in the way of greenhouses and season extension across our state. I think we have had enough weather patterns that say that we really do need much more season extensions in place, and growers are going after that now.
And
all right.
If I can just make one last comment regarding that, this is Melissa. Real Food Colorado, based up there out of Denver, they've kind of taken the lead on putting together some policies around, community gardeners, and it's possible, Dana, that the document that you put out to share with community gardeners as well as school gardens kind of highlights, some of the pieces about food safety. I think one of the things that has, kind of slowed down the school gardens a little bit, and I know even at our food bank we had some questions, was just, making sure that best practices are communicated to gardeners to encourage them to, grow food in a safe way, in a safe manner. And, there are some people that are really concerned about that, and there are some people that think it's just not that big of a deal. And my message regarding that is, to just know what Real Food Colorado has kind of put out there, possibly you too, Dana, and just have those kind of in your back pocket in case people ask. I know schools especially, they were really running into red tape in terms of being able to use the produce that was grown in even a school garden in their own cafeterias. And so, lots of work has been done there to try to, help ensure everyone that people can be safe. So that's my only kind of input there to complement what everybody else has said.
Thanks, Melissa. I have a series of questions and comments from one of our attendees that I'm going to read aloud and open up to the group. I'll ask Lisa to kick us off. Here we go. As a Native American woman, I am sensitive to the disparities with nutrition and health in communities that have higher poverty and lower socioeconomic communities. She's finding it hard to approach her own communities about eating healthier, stop buying the processed foods, and taking control of health so that we can stop and reverse the obesity trends. I have problems in the area of getting people on board. What is the best way to approach people and educate them about being healthier and actively taking a proactive approach in their health and in the health of those around them? Do we have any ideas, pointers, or resources to share about this topic and how to go about educating people on this particular issue?
So this is Lisa, and I will start a little bit with just sort of the mission of LiveWell Colorado, which really is about engaging all Coloradans in making healthier choices for themselves, and in making sure that we're providing environments where that healthy choice is the easy choice. And one of the things that you'll actually see coming from us very soon is the launch of a new advertising campaign on TV that is really about getting people to make healthier choices, to participate in their own health. Some of it begins with building awareness of understanding that it's a problem, and then of making choices. And we've chosen to take a positive approach to that in all of our messaging of, this is, I think you can get people defensive very quickly. And so how do you help them to see not just this as a health issue for themselves, but a quality of life issue? What are the things that are important to them? And so a lot of it starts with engaging on an individual level, particularly with adults. You pretty much have to do it on an individual level, and I think the more we can do to promote nutrition programs in schools, the school gardens are seen as a very effective way in which to get kids to be thinking about what are healthier food choices, understanding where their food comes from. So that can be a great way to start. And within some communities, figuring out what are those things that are culturally appropriate. What are the things that they either historically or even within their own current family, what are some things that they like to eat, and how can you grow some of those things and start cooking yourself? So really making it very culturally appropriate is a crucial piece of it, and making it age appropriate, and again, being positive about it. So we hope you'll see our new TV campaign will be launching later this month with some ideas of taking 4-day challenges, and what are some ways in which we can just one decision at a time, you'll see some fun things of, when do we pick the junk versus the fruit, and feel good about it, but taking it one decision at a time. So we hope to be doing, we are engaging in some things that we hope will move the meter a little bit and really paying attention to all of those different groups. I also know that within, for Native Americans, that there are some efforts going on through the White House, through the First Lady's Let's Move initiative, that are really focused on engaging within reservations and different communities. So that is another place to look for resources, is to go to the Let's Move website. And then, of course, we've got some on our website as well. I think Cooking Matters is another place where, when you're starting to think about the nutrition education and the cooking and those kinds of things, their resources are part of that as well. I don't know. Anybody wanted?
I can add something else to that. I think when I think about that whole conversation piece and starting to encourage people to be more selective in what they eat in order to be more healthy, LiveWell definitely comes to mind for me, for sure, and the materials and resources that you guys have been putting out over the past couple of years, I think, have been amazing. From a Native American perspective, to grow on that, I have also been amazed at the number of resources that are out there around food sovereignty. And there are quite a few tribes that have been coming together and really getting back to the basics and the roots of their culture and growing amazing crops and then selling them outside of the reservation and creating businesses around their cultural histories. And it started, the movement really started in one of the tribes in Oklahoma and has spread. And I know there are some efforts underway in the Navajo and Ute tribes in the southwestern corner of Colorado, but they're kind of just getting off the ground. It's the ones in Oklahoma that were really amazing, and they actually have annual conferences that they bring people together and talk about what each other are doing, and it's just, there's a whole movement afoot out there for sure that I think just typing in Native American food sovereignty, there'll be tremendous amounts of resources to tap into as well.
This is Tom Reed. I want to pile on this one also. So I've talked a little bit about our nutrition policy that we implemented about a year ago, and in this first year it's mainly been about changing what we bring in. So basically what's available to the clients through our food bank is generally a healthier product. The next step in our policy is to push that out to our clients and our agencies to educate them. Okay, these inventory items are rated green. Here's what it means. They're healthier choices. They're the choices you should make. These inventory items are yellow. You should eat fewer of them. And these items are red. You should stay away from them. So the next step in our policy development is to push that out to our clients and agencies and get that education out there and display for them when there's a product on the shelf, show them that it's green and that's a better choice than this item over here that has a red rating. So that's our next step, is that education piece.
Great, thank you. Next we have a comment for Karen. Has noted that she loves the visuals in your section. Making fresh produce look appealing is key, and she would like to learn more about the education piece and different ways this can be put into practice.
Well, thank you, Kelly. One of the things, our 2 food pantries at the Food Bank for Larimer County, we have a kind of a different way of shopping for our clients. They can actually come in to our food pantries. They're not just handed a box of food, but they can actually pick and choose from what we have on our displays for their own to bring home themselves. And in the produce section, we really like to make that look like a farmer's market. We like to pile the produce high and make it visually appealing. And then our food pantry volunteers and staff talk up the produce so that people really understand that this is a great thing to bring home. The taste testings that I talked about, the samplings, and the recipes have been really key in allowing our clients to actually take some produce and know what to do with it, because I think that a lot of us don't know what to do with all this wonderful produce, and I think that it's really our responsibility to educate our clients on what they can do with this produce. And then another really wonderful thing, in the last couple of years, we have teamed up with the local nurseries in the Fort Collins area, and they have donated plants to us, vegetable starts, at the end of their sales season, so in mid-June and such. And we actually are handing those out through the food pantry as well, telling people what it takes to maybe grow a tomato in a container if they don't have a backyard to plant it in the ground, and allowing people to grow some of this food for themselves. And our philosophy is truly, you can hand out fish, but you really need to teach people to fish as well. And that's our way of doing that. We've had great reception on that. Clients have come back and said they really enjoyed growing those fruits and vegetables themselves.
Thank you. All right, our next question is for Dana with Produce for Pantries. I am a home gardener. Who do I contact to contribute my extra produce this summer?
Well, this gives me an opportunity to repeat our new and wonderful collaboration with Hunger Free Colorado. So give the Hunger Free Hotline a call, and they will let you know the food pantries in your neighborhood. And once again, 855-855-4626 is the Hunger Free Hotline.
Thank you, Dana. We do have a few minutes left if you would like to type in any last-minute questions. I will remind you all that a follow-up email will be sent to you tomorrow with a link to a recording of this webinar and also a PDF of all of the slides that you have seen today with all of the resources that are in front of you. So we'll take maybe another minute or two for anyone to enter any last-minute questions. All right, thank you all for joining us today. Keep an eye on your email for our follow-up email tomorrow with the links to the presentation and also for our upcoming webinar on May 9th. Thank you all for joining us today.